targeted. Fourth, universal health care coverage. Mr. Speaker, the government is committed and determined to realize the constitutional right to health by promoting access to quality and affordable health care through universal health care coverage program. Towards this end, Mr. Speaker, I have proposed an allocation of 127 billion to the health sector to support various activities and programs. These include 4.2 billion for Kenya shillings, 4.2 billion for universal health care coverage, coordination and management unit, Kenya shillings 2 billion for free maternity health care, Kenya shillings 3.6 billion for managed equipment services, Kenya shillings 861.5 million to provide medical cover for the orphans, elderly, and severely disabled persons in our society. Kenya shillings 4.6 billion to cater for the stipend and acquisition of specialized medical equipment for the community health promoters, and 4.1 billion shillings for primary health care fund. Mr. Speaker, throughout the cases of HIV, AIDS, malaria, and tuberculosis, and enhance the vaccines and immunization program in the country, I have proposed Kenya shillings 28.7 billion for the Global Fund and Kenya shillings 4.6 billion for vaccines and immunization programs, respectively. Mr. Speaker, to enhance the early diagnosis and management of cancer and reduce the burden of treatment among Kenyans, I have proposed an allocation of Kenya shillings 1.1 billion to strengthen cancer management in Kenyatta National Hospital and Kisii Level 5 hospitals. I have also proposed Kenya shillings 2 billion to the Emergencies, Chronic and Critical Illness Fund. Mr. Speaker, to improve health service delivery, I have proposed a sum of Kenya shillings 29.7 billion for Kenyatta National Hospital and Moi Teaching and Referral Hospitals. This includes 2.6 billion for the construction of Kenyatta National Hospital Burns and Pediatric Center. I've also proposed Kenya shillings 5.2 billion for the Kenya Medical Supplies Agency, Kenya shillings 2.5 billion for the Kenya Medical Research Institute, Kenya shillings 1 billion for procurement of family planning and reproductive health commodities, and Kenya shillings 760 million for procurement of equipment at the National Blood Transfusion Services. Further, to strengthen the capacity of medical personnel, I have proposed Kenya shillings 3.7 billion for medical interns, Kenya shillings 406 million for training personnel, and Kenya shillings 8.6 billion for Kenya Medical Training Center. Finally, the digital superhighway and creative economy. Mr. Speaker, investment in digital superhighway and creative economy continues to play a critical role in enabling the government achieve the objectives of bottom-up economic transformation agenda through increased productivity and competitiveness. On the creative economy promotion of music, theater, and graphic design, digital animation,